My name is Dustin Lloyd, and I'm running to represent Missouri House District 39. Mental health is not a political talking point for me, it is personal. As a veteran, father, worker, and community advocate, I've seen how mental health challenges affect individuals, families, schools, workplaces, first responders, and entire communities. Too often, people are told to ask for help only to discover that counseling is unaffordable. The waiting list is months long. The closest provider is far away, or their insurance company will not cover the care that they need. That is not a functioning mental health system. As your state representative, I will fight to make mental health and substance use treatment more affordable and accessible. Mental health must be treated with the same seriousness as physical health. Insurance companies must be held accountable when they deny or delay medically necessary care. I will support greater investments in Missouri's behavioral health workforce. We need more counselors, social workers, psychologists, peer specialists, crisis professionals, and substance use treatment providers. We also need to support the professionals who are already doing this difficult work by improving compensation, reducing burnout, and expanding training opportunities. Schools must have resources to identify problems early and connect children and families with appropriate services. Teachers cannot be expected to serve as educators, counselors, social workers, and crisis responders without adequate support. Early intervention can help a child succeed in school, strengthen a family, and prevent a more serious crisis later. I will also advocate for veterans and first responders who face trauma, depression, PTSD, substance use, and an increased risk of suicide. Asking for help must be viewed as an act of strength, not weakness. Missouri should continue improving crisis response systems so that people experiencing a mental health emergency receive the right response from properly trained professionals. Law enforcement, emergency medical services, hospitals, and behavioral health providers must have the resources and coordination necessary to protect individuals and the public. Mental health policy must also include housing stability, food security, employment, transportation, and protection from discrimination. A person cannot focus on recovery while facing eviction, hunger, or the loss of essential services. No one should feel ashamed for struggling, and no family should feel as though it must face a mental health crisis alone. I'm running because Missouri House District 39 deserves a representative who will speak honestly about mental health, listen to affected families, and fight for policies that save lives. You matter. Your story matters. Help should be available when you need it. I would be honored to earn your vote.